Welcome, my dear students, to a topic on aging. You should know that there are certain recent topics which are being included in the curriculum and the text. One being aging. There are other such topics such as free radicals, radiation injury, apoptosis, and so on. So we should be aware of these and realize that they are components of the curriculum. A beautiful face over here, and then there is somebody else in the background. Nothing more to talk. A little picture is worth a million words. What do you people see on the screen? It is an image of optical illusion. The eyes do not see what the mind does not, or it can be vice versa. The eyes see only what the mind knows. So, you people can imagine and realize whether it is a young girl or an old woman. Please find out. Age is an issue of mind over matter. If you don't mind, it doesn't matter. Mark Twain, a very famous author. Definitions are definitions. No one words, please. Cellular aging is the result of a progressive decline in the lifespan and the functional activity of the cells. So, I would like to stress on the word cells. This is a definition from Roberts. There is something called as cellular aging, and there is something that is called as cosmetic aging. We are more bothered about the cosmetic aging, but little do we realize that our cells are also becoming old, so the tissues and the organs. There are two spellings over here. One is a British and another is American. AGE, AGI. Both are correct. When we talk about aging, it can be due to any of the following causes. It can be a physiological deterioration, diseases, environment, or lifestyle. So, we should have these things in mind. There are two theories to aging. One is called clonal and the other is replication. Clonal, all of us know it is genetic or inbuilt. So there is a mechanism which promotes aging. Replication, on the contrary, is there is a constant multiplication as a result of which it runs out of steam, out of energy, and there is a wear and tear. So two theories which we people shall write. For example, this is the clonal senescence. It supports the idea that there is an inbuilt allotted lifespan. We say the RBCs are for 120 days. Like that, every cell or tissue has got a lifespan. This is called as cellular senescence with a finite doubling. Finite means definite. Hayflick phenomenon. If you take the germ cells, they have got a greater potential for multiplication. If you take the stem cells, they can replicate to some extent. Whereas there are others which will multiply only if required. Aging has got a genetic component in about 40%. That is why you find that there are some species of mankind who will be living for certain years, and there are others who very comfortably touch the 90s. Longevity is inherited through the female line. If you very closely observe, females live a little longer than male. A gene on chromosome 1 may play a role, and there are interactions with the environmental factors. So this is clonal senescence. Very simple, taken from Robbins, taken from my notes, and I think you students can write. There is another thing called as replicative senescence. There is a progressive accumulation of sublethal damage. Lethal means it is dead. Sublethal, on the contrary, is there is a gradual injury and the cell does not die, but it leads to failure of the cell or the system. For example, there can be errors in the protein cross-linking, DNA cross-linking. There might be mutations in the DNA, mitochondrial dysfunction, and defects in oxygen regulation and nutrient carriage. All these can lead to sublethal damage. Oxidative stress. It can be induced and it can lead to a damage. Defective repair with accumulation of genetic and metabolic damage. So there is an inherited defect. At the same time, you find that there is a defect in the repair also, as a result of which you find that there is a shortening of the lifespan. Telomeric shortening. What is this? We'll be seeing. So these are all replicated. Telomeric shortening is quite important. We shall be seeing it and writing it in detail. Courtesy Robbins, before I proceed. Mechanism and counteractions of aging. On my left half, I find that there is a mechanism of aging. It can be environmental or metabolic results, insults. It can be telomere shortening. There can be abnormal homeostasis of proteins. So, the expansions are given over here. There can be the reactive oxygen species, which leads to increased amount of mutations in the DNA. Always, when there is a change in your DNA, there is an immediate attempt of the body to repair it. So, there is a repair, it will become normal. But when there is going to be a defect in the DNA repair also, there is a decreased cell function and there is a loss of cell. Telomere shortening, it leads to decreased cellular replication. There is a cell loss, again aging. Abnormal protein homeostasis, decreased amount of proteins or damaged proteins, leading to damaged and decreased functions. All of this can lead to cellular aging. On the contrary, there can be some corrective mechanisms such as restriction of calories, decreased insulin, and there can be insulin-like growth factor or TOR, which is decreased, target of rapamycin. All of this will lead to altered transcription, as a result of which you find that there is an increased amount of DNA repair, increased protein homeostasis, which all lead to a counteraction and a prevention of aging. So there is a mechanism on one side and there is a counteraction on another side. Please write this. This table will definitely make sense. This is the telomere. The telomere is nothing but a segment at the end of a chromosome. So, this is the centromere, this is the short arm and the long arm. At the end of either of these, you find that there are the telomeres. The telomeres will be a sequence of proteins. What happens is there is a progressive shortening of these. So what happens with the aging of the cell? They become shorter and shorter, and At the end, you find that there is no telomere at all. So there is a senile end that has been achieved, or a cell death, or an aging. So this is important. There is a telomere shortening, as a result of which there can be replicative senescence, environmental insults, and the defect in the DNA repair, all of which can lead to cellular aging. So this is important. Telomeres, you people shall and will mention. See what is happening over here. These are the segments at the ends of the chromosomes. These are all the telomeres. And what happens is they become shortened and shortened. So they become much less and still more less. As a result of which you find ultimately there is a chromosome without telomeres. So this is a mother cell. It keeps on multiplying. There are the daughter cells and they multiply. But what happens is when there is a shortening of the telomere, there is no cell division. There is a critically short telomere. That is what is mentioned over here. Beyond this point, it is not able to multiply. As a result of which, you get senescent or old cells. Senile. It comes from that word only. So, on the contrary, there can be an elongated telomere. It is a corollary of it. What happens if the telomere keeps on expanding? It becomes unlimited. You find that there can be a proliferation of the cells and there is an uncontrolled growth or a tumor. There is a bypass of the senescence and there is a formation of a tumor. If you go to various topics such as chemical carcinogenesis, etc., these are given. I shall take a detailed topic of telomeres for the postgraduates. Mitochondria, the powerhouses of the cell. You find that they will be having a lot of these infoldings called as cristae. Leave alone that. They produce the reactive oxygen species. There can be oxygen damage. There can be mutations to the DNA. Also, this leads to a mitochondrial dysfunction itself. Again, it goes on. So, there is a progressive damage to the cell as well as to the mitochondria, resulting in aging. So, mitochondria, you people should mention. See what all is happening within here. I told you that there can be the free radicals. So, this is the oxygen, and gradually you find that there are unpaired electrons. It becomes very active, called as free radicals. I will take a separate class on free radicals. There can be mutant mitochondrial proteins, damaged mitochondrial proteins, or error-prone DNA pore. So this is again a set of proteins over here. And also there can be a decrease in the DNA repair. Increase in damage, decrease in repair. Both mean the same. Ultimately, they can lead to DNA mutations. And there can be a cell death. Sometimes you find they are subject to reactive oxygen species, there is a nuclear damage and apoptosis. All of this result in aging. Now, what are the various organ changes in aging? Definitely you people know this. It is quite simple. Alzheimer's, all of us know. It is an aging defect. There is a diminished brain function. Presbyopia of the eyes. Constantly we have to change the specs. Cataract, senile cataract as such. Osteosclerosis. Change in the cochlear structure, nerve dysfunction. All can lead to a hearing loss. Cardiovascular system, a classical example is atherosclerosis or the calcification of the senile valves. Urinary tract, decrease in the glomerular filtration rate. Musculoskeletal, again we know because we see and feel. There is an osteoporosis, osteoarthritis, elasticity of the skin and the muscles. Atrophy. Genital tract, of course, there can be a prostatic hyperplasia on the other hand, atrophy of the genitalia on the others, the testes or the ovaries, involution of the breast. Sometimes there can be a carcinoma. Blood and lymphoid, there is a burnt out syndrome. The stem cell is no longer able to produce. It gradually wanes. So there can be various changes because of this. This is a very nice list wherein we can recollect the various changes. A few of them I have picturesquely demonstrated. So this is a normal artery. It is smooth over here. On the contrary, you find that there can be an atheromatous plaque, deposition of lipids, etc. Plaque means it is an elevated area, leading to narrowing of the lumen. And this is an advanced and a complicated atherosclerosis of the aorta. These are all holes called the ostia for the blood vessels. That is how I identify the aorta. But then there is not only thickening, I find that there are areas of hemorrhage. So the complication can be occlusion, thrombosis, embolism. There are certain major complications in the elderly patients, and this is the list. Hypertension, myocardial infarction, arthritis, gastrointestinal problems such as malabsorption, anemia, cataract, decreased glomerular filtration, cancers, and emphysema. Senile emphysema is again a point to be noted. Diabetes and fracture. Fracture usually an old person just falls by 1 foot. He has a fracture. Elastosis. You find that there is a loss of the recoil, and I find that there are wavy sets of bundles which no longer maintain the integrity. And this is being reflected in the form of wrinkles in the skin. Now look at this picture. There are two brains over here. Can you tell me the differences? Good. In one, there is a decrease in the weight. Also, I find as this is the gyre or the elevated portion, or the sulci, the darker areas are the depressions. I find that there is a widening of the various sulci, which means the parenchyma is becoming atrophic. There can be a senile atrophy of the brain, which can be very progressive in a case of Alzheimer's disease. And see what is happening in a case of Alzheimer's disease. A topic by itself, which I shall be dealing at a later date. But however, let us remember all this. You find that there can be amyloid plaques that can be formed, neurofibrillary tangles, cholinergic inefficiency, autophagy and dysfunction, mitochondrial dysfunction, neuroinflammation. These are all certain things which you people can see. I'll be dealing with this topic in detail in the nervous system. There are certain tumors related to aging, prostate. For example, maybe there is a change in the hormonal status, as a result of which you find that there is no control and the peripheral prostate takes over. There can be a prostatic cancer. Pancreas, bladder, stomach, lung. In fact, most of the cancers you find that the patient is older. Whenever I see a slide, I generally ask what is the age of the patient, because age and cancer go hand in hand. Protection against aging. There are certain methods by which we can, or the nutrition itself can prevent aging. Low calorie intake. The mechanism is there is increase in the free radical production with high calorie intake, and there is also a decreased mutation rate, decreased caloric intake. What will happen is with a decrease in the caloric intake, there will be a decrease in the mutation as well as a decrease in the free radical production, which can lead to lesser amount of aging. Physical and mental activity. Obviously, maintain the tensile strength of your muscles, the blood vessels. Good lifestyle, antioxidants, and this is becoming one of the prescriptions for the day. So these are various things that can promote. I would like you people to kindly memorize. Sirtuins are again a set of proteins, transcriptional regulators, telomerase function, AMPK, which means activated protein kinase, oxidative stress, accumulated AGE, stress on the endoplasmic reticulum, autophagy, mitochondrial damage, then IGF, insulin-like growth factor, amyloid, nuclear damage. All this can promote a cellular aging. So I would like you people to kindly by heart this particular picture. What is your comment on this picture? Is the individual young or old? A rapid aging called as Werner's progeria phenomenon or syndrome. If you are not convinced, look at it. The individual and the counterpart. So this is again a summary of the entire thing. You find that there can be various environmental factors such as toxins, chemicals, infections. Vitamin D antioxidants can prevent the aging. Mitochondrial dysfunction, it promotes aging. Toxins such as alcohol, tobacco, etc. All of this will lead to biological and chemical changes which can result in overactivation of INOS. INOS is inducible nitrous oxide synthase, cytokines, other enzymes, as a result of which there is intracellular accumulations, then oxidative stress, DNA damage, apoptosis, then premature aging and cell death. On the other side, it can be inherent or there can be a lack of exposure to the sunlight and other things. Almost a corollary of vitamin D, cumulative DNA damage, and poverty associated. So you find that there can be a malnutrition. All of this can. This is a beautiful, informative picture which you people can make of. Finally, you find that there are a good set of nutrients that you people can go to. In fact, you will be better informed than me. The antioxidants and the other things. Respect old age. It is your future. Courtesy stock. These are beautiful sets of pictures. And there is no point in stealing them, but then no point in throwing them away. Have great regards for them. Stock. Which of these is older or aging? But then one thing I noticed, both of them are extremely happy. Thank you.